Hi, welcome back to Acupuncturist Reacts, and on today's episode we're going to be looking at dry needling and what are the misconceptions out there, what is the information being put out there that's wrong, that's putting Chinese medicine in a poor light or portraying it in an incorrect way. So I'm going to expose that today, and before we get started on any further stuff, I just want to let you know that I am a real acupuncturist. I'm a registered acupuncturist in Australia, but the purpose of this series is to put people on the right path about what Chinese medicine and acupuncture really is. It's not to defame or, I'm not doing this to belittle other professions. It's just this one issue that gets my goat up. And it's not to have a personal attack at people in any way. That's not the purpose of this. It's just to to give Chinese medicine a fighting chance and show people what it can do, show people what it really is, rather than it being eroded by these misconceptions that are out there, these websites. So what I've done is I've just Googled on my iPad through Safari dry needling Melbourne, and one of the first ones that's come up is Melbourne Combined Natural Therapies. So we're just going to look on this website. I'm going to read this through and just talk about the things that are correct or not correct. Dry needling in Melbourne. Dry needling is an effective and efficient technique for the treatment of myofascial pain and dysfunction. The approach is based on Western anatomical and neurophysiological principles. Yes, that's true. Physicians, Dr. Travell and Simons, blah, blah, blah. Yes, that's all true, that paragraph. Myofascial trigger points are commonly seen in both acute and chronic pain conditions. They've got this little reference here, Handler and Kowalski site, blah, 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 but they've got no reference for that. So don't write it like that and not put the reference there. Anyway, the key element of successful needling treatment is having the person being treated. I should probably put a language warning on this. I'm trying to do it without the swearing, but it's really hard for me because it just gets me annoyed. The key element of successful needling treatment is having the person being treated experience what is called the needling sensation. This sensation may vary with treatment, but has been described as tingling, numbness, warmth, or other experience that is not simple pain. The key element of a successful needling treatment, so actually what they're saying here belongs to acupuncture as well, is having the person being treated experience what is called the needling sensation. This sensation may vary with the treatment, but it has been described as a numbness, tingling, warmth, or other experience that is not simple pain. Now, acupuncturists often refer to this as the De Qi response. It's just a Chinese translation of that, so that's fine to write it like that. Pain is not expected, or the desired response to dry needling treatment, although it is recognised that certain points may involve a painful response. Yeah, that's true. That can happen with acupuncture. Sometimes the needling sensation is experienced as propagating from the point of needling to another part of the body. What they're explaining here is not just dry needling. That is all of acupuncture. So within acupuncture itself, the actual act of sticking the acupuncture needle in you can elicit that response. That is what should happen. So then they go on to say, many medical doctors, remedial therapists, physiotherapists, chiropractors, and acupuncturists are using dry needling effectively to do that. So look, it's great that they've put that in there, that many acupuncturists are using this technique. The thing is, acupuncturists do use this technique. They use this technique. They are trained in this technique. They've used it from the first day they were born as an acupuncturist, or graduated as an acupuncturist, if you like. It's just part of what we do within acupuncture. It's not some other extra thing that acupuncturists have to learn. It's taught to you as part of acupuncture. It's just within dry needling have taken that one therapy. So look, those guys are not, that's not too bad. They've got a video here. Let's have a look at their video. Oh, got some nice music. So it's a 29-second video. Dry needling. What's happening? Oh. So they're just needling a couple of acupuncture points, bit of out of focus thing and some... So they're just showing someone, they shouldn't be touching the shaft of the needle there. We'll have to go in and have a look closer at what they're doing there. Let's have a quick look. Oh shit, they're touching the shaft of the needle, I think. I like the music, not. So generic. Look, I can't say for certain that they're touching the shaft of the needle, how they insert that, but it's almost there. And it's not, if you actually trained in it better, you could insert it like she's doing it there with that sort of freehand technique without having to come so close with the other hand to the needle. So that's one. I don't know if that's their clinic doing it or they're just utilising that video to show you. And we can't tell exactly. I don't want to defame their business if that's not what they're doing, but it does look very close to touching the shaft, which is the actual sterile part of the needle, which you don't want to touch. Okay, let's have a look at another one. elitemyotherapy.com.au. Let's see what they're saying about it. Look, dry needling therapy can greatly benefit your treatment in dealing with sore, stiff, or tight areas of your body. Here we educate you on what it is and how it works. It's important to give you some background information on the body and where pain can come from before we explain dry needling. So then they start to talk about voluntary muscles together make up the largest organ of the body, muscles susceptible to wear and tear. Oh, that's true. Muscles get stiff and sore. They can develop trigger points. So that's great that they're explaining that actually. So they're sort of explaining how trigger points can, okay, here we go. Start to talk about dry needling now. So you may experience a dull ache from the needle. This is a good response as it's working on your trigger point. Dry needling, a number of trigger points can be done in one session, with pain lasting 3 to 4 days after one session. Then at any sessions, any sessions after this, it will continue to improve and relief will be longer until it goes 100%. Right, okay, well, I can't guarantee you're going to get 100% relief from what I do, so that's good that they can say that. If any soreness is felt after a treatment, a heat pack can be applied 10 minutes after the treatment, but we rarely experience this with our clients, right? Yeah, so that can happen. Dry needling is not the same as acupuncture, although we do use the same needles. This is what they're saying on the website. Acupuncture is based on a traditional Chinese medicine practitioner diagnosing you through different areas that need to be worked on. For example, they may feel your tiredness or lethargy may be linked to your liver function or kidneys. So they will insert needles along a specific meridian lines or acupuncture points which relate to these organs in the hope of correcting this problem. Here we go. With dry needling, we work directly into a muscle that we feel is causing pain and eliminate this point. But we certainly do not go into the organ or the meridian side of things. I hope they don't go into the organ. We don't want them puncturing any organ. Please ask your myotherapist for a detailed description should you need one. Right, so what they're saying here is not untrue. Okay, it's not untrue what they're saying, but the way they're saying it makes it sound like, again, acupuncture is less scientific, or it's working on meridians and chi, the woo-woo-ness of acupuncture. So see the first video if you haven't seen that yet. So they may feel your tiredness, lethargy may be linked to your liver function or kidneys. Now, this would be a Chinese medicine system of diagnosis. If a patient came in with tiredness, if a patient came in with a musculoskeletal pain, like they would to a dry needling therapist, then we're going to treat them as what we call like a channel problem. So that actually is the system that we use as a musculoskeletal therapy type of problem, and that's very much aligned with the understanding of the body in terms of muscle and fascia and joints and all that sort of the musculoskeletal function of the body. So if a patient came to see me as an acupuncturist and said, Marie, I want you to help me with my tiredness, then I would use that Chinese medicine framework of diagnosis, maybe checking their pulse to see what the underlying cause is and to rectify that imbalance in that way, treating them functionally as in helping their body get stronger so that it can repel whatever's wrong with it. Now that can be super duper complicated, and it may be something like what they've mentioned here. Sometimes tiredness can be due to just something like a lack of exercise or a lack of physical function. So someone has, let's say they had knee pain and they were tired, then we might, by treating their knee pain and getting that resolved, they may have then the energy to do the exercise or the ability to do the exercise, and then the tiredness kind of goes away. That can be linked to it as well. So they're not wrong in showing that that's what Chinese medicine practitioners do, but they're basically introducing a new concept here, like is the person coming into dry needling coming in for tiredness, and they're saying, well, we're going to treat your tiredness with a trigger point? Are they saying that only acupuncturists can treat these internal medicine problems and not musculoskeletal problems? Because if we're talking musculoskeletal problems, which I assume we are, because this is a physiotherapy or a myotherapy type of website, so musculoskeletal problems are like back pain, neck pain, shoulder pain, some kind of muscular pain, some type of joint issue, something like that, then the acupuncturist isn't going, now I know this because I teach this stuff in school, and we don't necessarily have to go to what we call the Zhang Fu diagnosis, or the that system of, there's different systems for different types of problems. So we would use that musculoskeletal system, which is the very same thing that they're saying here, where we would palpate that area, find that trigger point, very often needle that trigger point, or do something in their body that's going to affect that trigger point in the same way. And there are lots of systems and differences, lots of ways that Chinese medicine works, techniques acupuncturists can use. So they can use dry needling techniques, which is local needling into the trigger point in the muscle to resolve that issue. In my practice, I use that sometimes. I often also use a distal needling approach, which means we don't needle that area, and there's reasons why we do that. And the reasons why we do that come into the 4 years of training that you've had, different patients that you've seen. But then, look, there's lots of different practitioners out there that have different approaches, so I'd encourage you to go and talk to your practitioner and see what they do. But this, again, bloody annoys me that they're kind of, the way they say it makes it sound like, you know, they're not doing such a bad job as some practitioners out there, but the way they say it kind of intimates that acupuncturists don't do what dry needling people do, which is untrue. They do that. Now, something that we have to mention here is these people, by offering dry needling in Australia, they are not breaking the law. And in many countries in the world, in many places around the world, this is a similar issue. They're just simply calling it another thing. And the reason why they can do it, and why I can't, like, as an acupuncturist, I don't go around saying, oh, I'd like to add physiotherapy to what I do, or I'd like to add chiropractic to what I do, because those professions have been registered as protection of practice and not just protection of title. So that is a massive issue, protection of practice versus protection of title. I can't go into it in this video, we'll be here all day long. So if you'd like to know more about that, stick a note in the comments and I'll make another video just about what that means. But what it means is that I can't go and practice chiropractic or physiotherapy or surgery or any of those other therapies that are registered protection of practice, whereas those people can take another modality, call it something else, as long as they're not breaching the protection of title. So they don't use my title. They can't call themselves an acupuncturist, but they could call themselves a dry needler and use that. So it just leaves it open to a lot of different people using it. Now, the benefit of a physio or a chiropractor doing dry needling versus a massage therapist or another person who's not even a therapist, who's just a home trained person, someone that's learnt it off Google or something like that, is that at least with a physio or a chiropractor, they've already, it's unlikely that, or it's less likely that they're going to do something to puncture your organs, or because they know the physical anatomy, and so it's less risk, which is why we haven't seen too many problems in Australia yet, because a lot of the practitioners doing dry needling are already registered in another profession and they kind of know the physical body well. They're not going to do some damage to your organs. But in these short courses that are taught, that often people aren't taught the whole range of techniques that how to use them, and they go home and practice them and something can happen. All right, let's go to another one. Melbourne sports med. So again, we're just Googling dry needling Melbourne sports. Right, so needling or dry needling is becoming increasingly popular as a technique for a range of musculoskeletal conditions. Good. Dry needling involves the insertion of needles around trigger points. Myofascial trigger points are points in which muscles are painful and when pushed feel like small knots. Needles are inserted into these trigger points to deactivate and release them. Dry needling is used by several of our practices as an adjunct to physical or medical treatments for musculoskeletal problems. Okay, well, thank God they haven't put anything about acupuncture on here. They haven't mentioned acupuncture. They haven't compared it with acupuncture. They've just kind of said it is as a particular thing. Now, what you need to know is with these people, this is what I would do. I don't know because I haven't looked yet, but what is their training in dry needling? So if we know now that an acupuncturist can do that very well, 4 years of training that they can, that they're trained in just, that's what they do. They stick needles in all day long, right? It's not like with a physiotherapist, they do manual techniques, they do manipulation on muscles, they do all kinds of things. They use TENS machine, they use electrotherapy stuff, they use like stretching machines and different sorts of things. Depends on the style that they use, right? I'm not a physiotherapist, so I don't know all the stuff that they use, but I've seen them use all those things. And then they use dry needling as well. Like how many hours have you spent ask your physiotherapist, how many hours have you spent sticking needles in, practicing on a cushion, doing that kind of thing. So that would be my beef with those people. Now, something that we have to mention here is these people, by offering dry needling in Australia, they are not breaking the law. And in many countries in the world, in many places around the world, this is a similar issue. They're just simply calling it another thing. And the reason why they can do it and why I can't, like, as an acupuncturist, I don't go around saying, oh, I'd like to add physiotherapy to what I do, or I'd like to add chiropractic to what I do, because those professions have been registered as protection of practice and not just protection of title. So that is a massive issue, protection of practice versus protection of title. I can't go into it in this video, we'll be here all day long. So if you'd like to know more about that, stick a note in the comments and I'll make another video just about what that means. But basically what it means is that I can't go and practice chiropractic or physiotherapy or surgery or any of those other therapies that are registered protection of practice, whereas those people can take another modality, call it something else, as long as they're not breaching the protection of title. So they don't use my title. They can't call themselves an acupuncturist, but they could call themselves a dry needler and use that. So it just leaves it open to a lot of different people using it. Now, the benefit of a physio or a chiropractor doing dry needling versus a massage therapist or another person who's not even a therapist, who's just a home trained person, someone that's learnt it off Google or something like that, is that at least with a physio or a chiropractor, they've already, it's unlikely that, or it's less likely that they're going to do something to puncture your organs, or because they know the physical anatomy, and that, so it's less risk, which is why we haven't seen too many problems in Australia yet, because a lot of the practitioners doing dry needling are already registered in another profession and they kind of know the physical body well. They're not going to do some damage to your organs. But in these short courses that are taught, that often people aren't taught the whole range of techniques that how to use them, and they go home and practice them, and something can happen. So, all right, here we go. All our physiotherapists are trained in dry needling. Oh, how much training do they do? I'd like to know that. Are trained in dry needling, which is a Western adaptation of the ancient Chinese medicine form of acupuncture. That's incorrect. That's wrong. Okay. It's not a Western adaptation of acupuncture. Dry needling is a therapeutic technique that is used by acupuncturists. We just don't call it that. We haven't called it that until now because of this competition of people using dry needling and all the issues I'm saying now. So now I would tell patients that I do dry needling. I've always done dry needling. I just haven't called it dry needling. But they're saying dry needling is an adaptation of acupuncture. Dry needling was always a part of acupuncture. The techniques that are used, the research that's there, that was researched by dry needlers separately, and the reasoning for that and all that. But those techniques have been used and been done quite successfully by acupuncturists. They're already within acupuncture, and they've been part of acupuncture for many thousands of years. And it's not just like a 50-year-old therapy that physios have propagated those therapies. Okay, they go on and say, we use dry needling in a physio way. Oh, in a physio way, to release off muscles through needles rather than massage or mobilization. Okay, cool. This is a great option for some conditions which are very sensitive to, such as muscle spasm or highly painful conditions where the needle will release the muscle without requiring deeper touch of other modalities. Totally true. And I would do that in my practice, but I wouldn't call it in a physio way. That's just what acupuncture does. That is part of when you insert an acupuncture needle into a trigger point, that's what it will do. Okay, now they're just calling it dry needling, and they're giving some other kind of, reasonings for saying that it's different, but it's actually the same. Right, here we go. Right. It can be used to treat a variety of ailments from RSI to back pain, headaches to neck pain. We find we get very effective results for sports injuries such as Achilles tendinosis, patella tendinosis, hamstring tightness, or glute tightness. Now, this is what gets me angry right now, is that in Chinese medicine, our law is prohibiting us from mentioning conditions where we don't have sufficient evidence to show that acupuncture can treat or can be effectively treating those conditions, right? So as a practitioner in acupuncture, I tend to propagate the idea that I treat patients, I treat people, your body then treats the condition, if you like. Acupuncture needles can't put any medicine into you and treat you in that way. It's your body that's doing that's doing the healing. But yeah, I get that the idea that you come to a practitioner with a problem and you want to be treated for that problem. So you, as a person with Achilles tendinosis or patella tendinosis, which is like a be a tendon issue in your knee. Then, okay, so is there evidence to show that? Like, because I can't say that about acupuncture, and yet they can say that about dry needling, even though the therapy that's being done is the same. Both practitioners, like, I'm prohibited from using that advertising, but they can use that. So that annoys me. Your physio may suggest it as part of your treatment, so please let us know if you have any reservations, especially those who are scared of needles. Alternatively, if your physio doesn't suggest it and it's something you'd like to try, please let us know. Fair enough, blah, blah, blah. So, yeah, look, I have a bit of a beef with that. It's not with those individual people. It's just that they are, and look, what they're trying to do at the end of the day is sell their product or their service and encourage people to use it or explain to them what it is so that they can be well informed before they come and have it. That's all, that's all normal, part of business. But the part of my business is I've got to stand up for my profession. These views are my personal views. They're not necessarily the views of my whole profession. People that are friends of mine may share this video. Okay, CPD health courses come up again. And the dry needling course is here. So, this tells us how long the course is. So this one, dry needling courses in Melbourne. For just $749, you can do the introductory course. And then you've got the advanced course and then the 80-hour course. So at least it's a little bit longer than a few days, but 80 hours isn't really that long. It's probably like 2 weeks or so. So 10 days, let's say 10 days straight or like 12 days of teaching if you taught it all day long. It's not a long time learning something over, I don't know exactly how long they teach it over, but for 80 hours. And then there's other ones you can do more advanced, but doesn't say how long they are. But that's not a long time. An acupuncturist has spent at least a whole year without even touching any patients, just learning about where the points are, learning about the how to insert the needles and all different stuff. And I mean, they're not just learning that in the first year, but they're doing 4 years of study versus someone who's doing 80 hours. And you don't find me trying to. I mean, the law prohibits me from doing that as well, but the reason why I'm making this video is because the law doesn't prohibit people from doing this, and then people are taking advantage of this, and I think that's wrong. I don't think that's right. I could start my own dry needling course and make heaps of money out of it, and the reason why I don't do that is because I've got ethical standards. Like, I could be teaching dry needling and making a fortune out of that, and be very, very well paid for that. Anyway, dry needling, let's keep going, musclefreedom.com.au, I think it is. Muscle Freedom, sounds like a good name for a business. Dry needling involves inserting a hair-fine, single-use sterile needle, acupuncture needle in brackets, into a trigger point. It has been found in many research studies to be extremely effective in releasing the pain and tightness associated in trigger points. Yes, exactly that. Acupuncture is doing that as well. If an acupuncturist is using dry needling techniques, totally would be doing the same thing. Dry needling may also strengthen tendons and ligaments by inducing a local inflammatory response to the disturbed tissue. Absolutely. Acupuncture does that too. And getting blood flow to the area kind of helps, overall people's healing and strengthening muscles. It can help with all types of muscle injuries, from tennis elbow, tension headaches, and sciatica. Again, this is another issue. So AHPRA prohibits Chinese medicine practitioners who are registered acupuncturists. Some of these things we may not be able to say. Would we be able to say that acupuncture can help with tennis elbow? I don't know. We certainly would need to quote the research there. There's no research on this website saying that, they're saying it has been found in many research studies to be extremely effective, and then they say it's going to treat tennis elbow or help with tennis elbow, but there's no research there for the tennis elbow. So how do we know? By combining, so what I'm saying is, if I was to put that on my website for acupuncture, or say dry needling, even to put dry needling on my website and say that like that, I would be required by law to put the research there. But because they're not a registered acupuncturist, they're not required by law to put the research there. So therefore, it's easier for them to mislead people in that way, because they don't have to put the research there. By combining dry needling with remedial massage, your therapist has the best opportunity to relieve. Yep. Look, combining dry needling or acupuncture with massage is a great thing to do. I often see patients who have a massage and then had dry needling or acupuncture from me after or before the treatment. That's not an incorrect thing to say. That's great. Okay, so here we go. Most patients who experience dry needling for the first time are surprised and with the little sensation and the local twitch response, all that sort of stuff, that's all good. So that look, some of that stuff's good. The only thing I have a problem with on that website is the fact that it's not their fault. They're not breaking the law, by the way. I'm just pointing out that the law is skewed. That's just how it is. And it's like, if I was to put that on my website, I'd have to put the research, but they don't have to do that. Okay, let's have a look at another one. Next page of Google. What is dry needling? This is Melbourne Spinal and Sports Medicine Clinic. So these guys have got a lot of information about how it started and where it came from. Let's have a look. Okay, I think we're going to have something to say about this. Dry needling is performed at the MSSP. Well, so we don't even know what that is. For a start, they've used an acronym we don't know. So just bamboozling us with acronyms we don't know what they are. They haven't explained that. To treat patients with headaches, jaw pain, neck and back pain, sports injuries, and to joints and muscles, to enhance pain management, incorporate with physiotherapy treatment to improve function. Needling of muscle trigger points was first developed in the 1800s. Wrong. It was developed way before that, dude. So sorry about that. But Acupuncturists have been using needling muscle trigger points since the Han Dynasty. Progressed with formal research by Dr. Callaghan in 1930 and later by Dr. Lewis in 1940s. Dr. Janet Travell who was president JFK's physician, further developed the treatment of trigger points. That's all true, and that is the progression of that particular therapy. But by saying they're the first people to ever needle a trigger point, or that was the first time, that's wrong. The concept of dry needling was initiated due to the philosophical concept of acupuncture in traditional Chinese medicine, TCM. TCM acupuncture was based on energy pathways and the flow of qi, energy-based, and the spiritual concepts that were understood in China 5,000 years ago. That's wrong. The spiritual concepts, there's philosophical concepts there, but they are scientific concepts, and it's not woo-woo and mysticism as they're putting it out here. It makes it sound like Chinese medicine's hocus pocus and dry needling's scientific and using the muscles, whereas I don't know, TCM practitioners use acupoints, and then it's got in the little quotes, qi energy flow via meridians to treat patients. This just really annoys me. Where do they think we're putting those needles into their qi? The points, those acupoints that we use are in muscles. So it's just a different way of looking at things. It's a different way of understanding how the body works. So by sticking a needle in and getting a twitch response from a trigger point, so let's say if you would just purely think about it from a Chinese medicine perspective, a patient would say, I've got pain here. You'll palpate that area. You would find the trigger point, which is like a tightness in the muscle. The Chinese would, in Chinese medicine system, they call it an AHPRA point. So it's like a tight, painful kind of spot. You feel like almost the fibrous muscle tissue sort of, The thing is that, there was a period of time in acupuncture where these concepts were kind of propagated and then misunderstood. And it also comes back to just popularism. It's been popular at times for things to be spiritual. It's been popular at times for things to be mystical. And it's also part of it's just a lack of understanding, which maybe you could even think of it as a kind of a racism, just because you don't understand those concepts and what they mean. It takes a really great mind to understand what were the Chinese trying to say back in the Han Dynasty when they were writing about acupuncture in the older textbooks. What were those things meaning? That takes a really great scholarly mind to be able to understand that and teach that. And unfortunately, there's not many of those people around. And so what has been taught in acupuncture schools sometimes has been that concept. Or maybe students or there's been times where people, they have an affinity to that. And, at acupuncturists, we're guilty of marketing things the way we want to market them as well. And so there's no spiritual belief that's needed for acupuncture to work, and there's not a mystical force that you're needling into. There's a lot about the human body that we don't understand. Even with all the technology and the things that we have, we cannot necessarily quantify everything that happens in a human body with our scientific understanding. There's things that the Chinese have explained about how the body works, and particularly the interconnectedness of the body, which when you learn it as an acupuncture student, like, it does seem mystical. It does seem a little bit like it's a concept. It's a metaphorical concept. There's a lot of things that are metaphorical concepts. And so, you know, you kind of understand this, and it's not until you see it actually working in clinical practice where you see, you know, the way diseases play out. But yeah, don't get me wrong, the theory that Chinese medicine is based on is incredibly scientific, and it's not mystical. So they're basically saying that, you know, back at that time, which I would just say is due to ignorance, that just that lack of understanding, how it was propagated, and that's a misfortune on our part. But I'm making this video. This is my little way of trying to rectify some of that and put the right knowledge in people's heads, that you know, that it's not like one or the other. It's not like if you have acupuncture, you're accessing some sort of, you have to access chi and meridians, and this energy flow business. What that is a whole nother concept, and we don't have time to get into that like right at this moment. But yeah, let's keep going with this website. So dry needling can be performed following the pathway of the nervous system. Good on them that they've actually got some research there. Like, they've actually got some people that they're quoting there, rather than just saying research says and not having that. So that's a good thing. For example, the pathway of the sciatic nerve and its branches can be followed for those with sciatic or back pain. The brachial plexus and the branches of those with neck or arm pain can be, and the intercostal nerves for those with intercostal pain. Similarly, dry needling can be applied. So what's really interesting is, yeah, okay, they are saying they are only using that, but the way that, so Chinese medicine practitioners in acupuncture school, they learn all of this stuff. They learn not in as much detail as a physiotherapist uses, because that's not their modality. Like let physiotherapists do what they're great at doing. And you know, I'm not trying to say acupuncturists can do what a physio does, but we are taught, we do teach students about nerve pathways. They learn about, like, so you can almost see it like that overlay of different aspects of the body. And so then once you understand all those things, so you understand the body from a Western anatomical perspective, and then, you know, it's like a biochemical perspective, and then understanding it from the Chinese medicine perspective, you can actually see the interplay of those things together. And you think, wow, that's so, like, what I think is like, wow, that's so clever that the Chinese were thinking of that before they did understand nerve pathways and things. Like, it's a misconception to think that the Chinese didn't, they did do surgery, they did open up people's bodies, but they just tried to find other ways and propagated other ways of treating things, rather than you know, as far as the West went in terms of like dissecting and cutting things down to the, you know, the smaller details. Again, getting off on a tangent. So, hi, thanks very much for watching Real Acupuncturist Reacts. I hope you've learned something and hope you had a little bit of fun along the way. Please join me for my next video by subscribing to my channel, and if you want to, you can leave a comment in the comments below. Thanks, have a great day.